This conference will now be recorded.
Hello, my name is Amanda Kulix, and I am calling you from sunny South Florida. We are your local SHINE program at PSA 9. We serve Palm Beach County and the Treasure Coast. I have the distinct pleasure today of having the opportunity to present our Medicare 101 presentation to you. And what the Medicare 101 presentation is essentially an overview of Medicare coverage. We go over parts A, B, C, and D, as well as Medicare supplement insurance. We also call that Medigap insurance. Before I get into those parts, I want to let you know what the SHINE program is and why we are present in South Florida providing great information. So the SHINE program is a Florida Department of Elder Affairs program. We are a part of a nationwide state health insurance program. These are known as SHIPs. There are SHIP programs in all 50 states and all 4 U.S. territories. The Florida Department of Elder Affairs receives annual funding for the SHINE program through a federal grant by that same name, SHIP, S-H-I-P. The Florida Department of Elder Affairs vision is all Floridians aging with dignity, purpose, and independence. SHINE's mission is to provide free and unbiased health insurance counseling through a dedicated network of volunteers, empowering Florida seniors to make informed health care choices. We also want to let you know SHINE is a free program offered by the Florida Department of Elder Affairs in partnership with your local aging and disability resource centers. Specially trained volunteers assist with your Medicare, Medicaid, and health insurance questions by providing one-on-one counseling and information. SHINE services are free, unbiased, and confidential. SHINE is not affiliated with and does not endorse any insurance company or product. And if you are in our area, you are in the lavender section on the right-hand corner. There are 11 aging and disability resource centers in the state of Florida, and they're all. This program is all administered through the Department of Elder Affairs. These centers, these aging and disability resource centers, are independent, not-for-profit organizations responsible for ensuring the availability of services to all elders in Florida. The SHINE program contracts annually with the Aging and Disability Resource Centers to provide counseling services locally. So let's tell you a little bit about what SHINE does. The primary duty of a volunteer SHINE counselor is to help Florida seniors identify, understand, compare, and or enroll in original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplemental insurance, also known as Medigap. We also screen and help you apply for programs like the Low-Income Subsidy, also known as Extra Help, a program that assists with prescription drug costs, and the Medicare Savings Program, a program that helps support seniors who are low income by helping them pay for their Medicare Part B expense. SHINE counselors also have the opportunity to support individuals who need to file Medicare complaints and appeals. And through the SHINE program recently has an opportunity through the S&P grant to provide education on Medicare fraud and abuse, including how to prevent yourself from fraud, how to detect fraud, and how to report fraud. Let's dive into an introduction to Medicare by starting with the very basics. What is Medicare? Well, Medicare is federal health insurance for qualified individuals. It's administered through CMS, the Center for Medicare and Medicaid Services. Unlike other types of health insurance programs, Medicare benefits do not extend to spouses or other dependents. All eligible people are enrolled individually if they want Medicare coverage. Medicare was created by Congress in 1965 as a Title 19 of the Social Security Act under President Lyndon Johnson. Medicare became effective July 1st of 1966. Medicare is the nation's largest health insurance program, covering nearly 50 million Americans. There are 4 million Medicare beneficiaries in Florida. Social Security Administration is responsible for enrolling most people in Medicare. The Railroad Retirement Board is responsible for enrolling railroad retirees into Medicare. Medicare has the following parts. Medicare Part A helps pay for inpatient hospital stays and helps cover eligible skilled nursing care, home health care, and hospice care. Part B covers medically necessary services like doctor's visits and outpatient care. Part B also covers preventative services, including screening, tests and shots, diagnostic tests, some therapies, and durable medical equipment like wheelchairs and walkers. Part C is another way to get your health benefits through Medicare. It provides Part A and B coverage and often Part D. Part D stands for prescription drug coverage. Medicare Advantage plans are managed by private insurance companies approved by Medicare. These plans must cover medically necessary services. However, plans can charge different copays, coinsurances, and deductibles for these services. Part D is Medicare drug coverage that helps pay for outpatient prescription drugs. Let's talk about Medicare eligibility. There are only 2 eligibility requirements for Medicare: citizenship and age. Other factors may impact a person's costs under Medicare, but they have no impact on Medicare eligibility. Some of these factors are current health condition, employment history, Social Security or FICA contributions. A disability is a physical or mental condition that has prevented someone from working or is expected to prevent someone from working for at least 12 months or end in death. To be eligible for Medicare under a disability, the condition must meet Social Security's criteria, and the individual must have been receiving Social Security disability income, also known as SSDI, for at least 24 months. There are 2 conditions which may qualify someone earlier than 24 months. End-stage renal disease, ESRD, is a permanent kidney failure that requires a regular course of dialysis or kidney treatment. ALS is amyotrophic lateral sclerosis. This is a disease of nerve cells in the brain and spinal cord that control voluntary muscle movement. To enroll in Medicare, a person must go through the Social Security Administration. This is facilitated through phone call to your local Social Security office, or could be done online at www.ssa.gov. It used to be that people began receiving Social Security retirement benefits when they turned 65 and were automatically enrolled in Medicare Parts A and B by the Social Security Administration. Since Part B has monthly premiums, most people choose to opt out if they do not need coverage. Now, most people delay signing up for Social Security retirement benefits until after age 65 so that they can get maximum benefits allowed. Any person who chooses to delay these benefits must voluntarily enroll in Medicare when they are eligible. When a person turns 65, they first become eligible for Medicare. This period of time is called an initial enrollment period. The effective date of your Medicare coverage will be based on what period of time you enroll during your initial enrollment period. In this example, if your birthday is in April, the first 3 months prior to your 65th birth month, January, February, and March, your effective date starts on your 65th birth month. In this example, that is April. During your 65th birth month, your effective coverage is the following month. In this example, that's May. Notice what happens when you wait to enroll. If you wait to enroll in the months following your 65th birth month, you may experience a 2-month delay in coverage. So the person in this example waited till May and did not receive coverage until July 1st. And if you choose to enroll 2 or 3 months after your 65th birth month, you may experience a 3-month delay. In this situation, if a person chose to enroll in June or July, they would not receive coverage consecutively until September 1st or October 1st. So to review, the best time to enroll is during the 3 months before turning 65. Please note that if your initial enrollment period is due to 24 continuous months of Social Security disability insurance, also known as SSDI, enrollment in Medicare is usually automatic. Let's talk about Original Medicare. We'll start with Part A. Medicare Part A is inpatient coverage. Medicare Part A helps people pay for services when they are deemed medically necessary. Inpatient hospital care, blood after the first 3 pints, skilled nursing facility care, home health services, and hospice care are some of the Part A services covered. Not all charges incurred during a hospital stay will be covered by Part A. Only those that are billed as a part of the hospital's standard inpatient care. Other charges may be covered under Part B. Medicare Part A only covers patients that have been formally admitted into the hospital and are receiving inpatient services from a hospital that accepts Medicare. Part B covers most outpatient services, as well as hospital charges that are not billed as inpatient care, usually with a 20% coinsurance. Part B also covers emergency room treatment. With the exception of emergency rooms, Medicare will only cover services rendered by a provider who chooses to accept Medicare. Original Medicare is fee-for-service. Medicare pays as services are provided. People in Original Medicare may go to any doctor, specialist, hospital, or other healthcare provider that accepts Medicare. While most people don't pay a premium for Part A, they are responsible for a Part A deductible for inpatient hospital stays. The deductible is the amount a person with Medicare must pay for health care before Medicare begins to pay. There is a deductible per benefit period. A benefit period, also known as a spell of illness, begins when a person starts to receive Part A covered services and ends after 60 consecutive days without Part A inpatient coverage. People with original Medicare are also responsible for some co-payments, a dollar amount, or co-insurance, a percentage for Part B services. The amount depends on the service, but is 20% in most cases. People who choose Medicare Part B usually have the premium automatically taken out of their monthly Social Security or Railroad Retirement Board payment. Medicare sends a quarterly bill for Medicare Part B premiums to people who don't get a Social Security payment. Note, everyone is charged a monthly Part B premium. Because the low Social Security cost of living adjustment, also known as a COLA, has a statutory hold harmless provision designed to protect seniors. This largely prevents Medicare premiums from increasing for most beneficiaries. However, because of this statute, there are two Part B base premiums, as explained below, for 2020. Everyone is charged a monthly Part B premium. While Social Security's cost of living adjustment was low, a statutory hold harmless provision designed to protect seniors will largely prevent Part B premiums from increasing for most beneficiaries. For 2020, there is an increase in the Social Security benefit SSA affecting the two base Part B premiums. Those who are at a 109 premium are considered held harmless. These individuals were enrolled in Part B prior to 2020 and have been collecting Social Security benefits. They are not dual eligible beneficiaries who have been receiving Medicaid. They are not subject to income-related monthly adjustment amounts. A person whose Part B premium is $144.60 is subject to the Social Security increases. These individuals are still protected. They will not see a Part B increase that is greater than the increase in their Social Security benefits. Let's talk about Medicare supplemental insurance. Original Medicare pays for many health care services and supplies, but doesn't pay all of a person's health care costs. A Medigap policy is supplemental insurance sold by private insurance companies to fill the out-of-pocket gaps in coverage under Original Medicare, such as deductibles, coinsurances, and copayments. The insurance companies that sell these policies must follow federal and state laws that protect people with Medicare. The Medigap policy must be clearly defined as Medicare supplement insurance. A Medigap policy only works with Original Medicare Part A and B. If you join a Medicare Advantage plan or other Medicare plan, your Medigap policy by law cannot pay any deductibles, copayments, or other cost-sharing plan. So you cannot have a Medigap and a Medicare Advantage plan. A Medigap policy must be one of 10 standardized types so people can compare them easily. Each plan type has a different set of benefits. The benefits in any one Medigap plan type are the same for any insurance company. It's important to compare Medigap policies because prices can vary. Please note that insurance companies don't have to offer every Medigap plan type. Each company decides which Medigap policies it will sell and the price for each plan with state approval. Plan F also offers a high deductible plan. You must pay for Medicare covered costs up to the deductible amount before your Medigap plan pays anything. G also has a high deductible plan that operates in the same fashion. Part B coinsurance. Note that plans K, L, and N will require you to pay a portion of your Part B coinsurances and copayments, which may result in lower premiums for these plans. All other Medigap policies pay them at 100%. Not all types of Medigap policies may be available in all states. People under the age of 65 with end-stage renal disease may not be eligible for Medigap insurance until they reach age 65. Florida law requires insurance companies to offer Medigap policies to people under age 65 with end-stage renal disease. While people with original Medicare, Parts A and B, can purchase Medigap policies at any time, they may not be covered for a guaranteed issue right, and therefore may be required to pay more for pre-existing health conditions. The best time to buy Medigap is during the Medigap Open Enrollment Period. Medigap Open Enrollment Period is first triggered by enrollment in Part B. It lasts 6 months after you first start Part B. Let's talk about Medicare Advantage plans. While original Medicare Part A and Part B, perhaps with an optional Medigap policy, are one way to get Medicare coverage, people may choose instead to enroll in an all-inclusive Medicare Advantage plan. Medicare Advantage plans are also known as Part C plans. It is important to note that people who join a Medicare Advantage plan are still enrolled in the Medicare program. Also note they still get all their regular Part A and B covered services, and they still have Medicare rights and protections. They're just choosing to access their Medicare in a different way. Medicare Advantage plans are bundled policies. Members usually get all of their Medicare-covered health care under that single plan, including hospital, medical, and prescription drug coverage. People may have to use specific doctors that accept the plan or go to certain network hospitals to get covered services. Because all Medicare Advantage members are still receiving Medicare coverage, they are responsible for paying the Part B premiums. Depending on the specific Advantage plan, members may have to pay other costs, such as additional premiums, co-payments, or coinsurance for their covered services. The plan may offer extra benefits such as coverage for vision, hearing, dental care, or health and wellness programs. There are 5 main types of Medicare Advantage plans. Health maintenance organizations, or HMO plans, are plans in which members must generally get health care from providers in the plan's network. Members have a primary health care physician who must pre-approve all referrals to a specialist. Some HMO plans offer a point of service option, or POS option, where members can go to doctors and hospitals that aren't part of the plan, but it may cost more. Preferred provider organizations, or PPO plans, are similar to an HMO, but members can see any doctor or provider that accepts Medicare and they do not need a referral to see a specialist. Going to a provider that is outside of the plan's network will generally cost more. Private fee-for-service plans, or PFSS plans. Members can go to any provider that accepts the plan's terms, and they may get extra benefits. The private insurance company decides how much it will pay providers and how much members pay for services. Special needs plans. Special needs plans are limit all or most of their membership to people in certain long-term care facilities like a nursing home, people who are eligible for both Medicare or Medicaid, or people who have certain chronic or disabling conditions. Special needs plans are available in limited areas. Medicare Savings Account plans have two parts. One part is a Medicare Advantage plan with a high deductible, and one part is a Medicare savings account a medical savings account into which Medicare deposits money that people can use to pay health care costs. If used for medical expenses, the money is tax-free. However, these are very rare and they are not available in Florida. Let's talk about prescription drug coverage. As we discussed Medicare Part D, there are several important things to keep in mind. All people with Medicare are eligible to enroll in a Medicare drug plan. People must be enrolled in a plan to get Medicare drug coverage. This coverage is not automatic like A and B. Medicare drug plans are offered by insurance companies approved by Medicare. There are two types of Medicare Part D plans. If you are on our original Medicare, you could purchase a PDP, or prescription drug plan. These are standalone drug plans that add coverage to original Medicare and other types of Medicare plans. An MAPD, or Medicare Advantage prescription drug policy, is most Medicare Advantage plans include prescription drug coverage. The term Medicare drug plans is used throughout this presentation to describe both Medicare PDPs and Medicare Advantage plans with drug coverage. Please note that costs vary depending on the plan. For coverage in 2020, people will generally pay, number one, a monthly premium, which varies by plan. Some plans have $0 premiums. Others have higher premiums, but might offer more coverage. Most plans fall between $30 and $60 a month. You will probably be asked to review your plan for an annual deductible. An annual deductible is the amount plan members must pay for prescriptions each year before the plan starts to pay. These amounts can change every year. Some plans offer a $0 deductible, usually for a higher premium. No plan can have a deductible higher than the standard amount. Most of your medications will have a co-payment or co-insurance connected to it. These are your out-of-pocket costs after meeting your deductible, if you have one. In some plans, the co-payment or co-insurance is the same for any prescription. All plans must assign a tier for each drug on their formulary. Discounts for drugs happen during the donut hole, also known as the coverage gap. While in the donut hole, the plan pays nothing. some plans do not have this coverage gap. Once a beneficiary reaches the dollar amount shown in an out-of-pocket drug cost, they pay 5% or a small copayment for the remainder of the calendar year. This is called catastrophic coverage. The amount people pay in some plans may vary depending on how much they have spent that year. Under the standard benefit, once the deductible is met, members pay 25% coinsurance until they reach the coverage gap. Let's talk more about the donut hole, also known as the coverage gap. This is on a calendar year basis. Medicare prescription drug coverage is divided into 4 levels. Level 1 is the deductible level. During this period of time, the beneficiary pays 100% of drug costs until the deductible is met. The deductible may be 0, but it cannot exceed the standard amount. For 2020, that's $435. The deductible begins January 1st. The second level is initial coverage. A beneficiary pays a coinsurance, and the plan pays the balance. 25% is the standard amount that beneficiaries pay. The beneficiary's coinsurance is 25%, and note that the plan pays 75% during initial coverage. The third level is the coverage gap, also known as the donut hole. Then, during this period of time, the beneficiary pays 100% of drug costs while in the gap. The coverage gap begins when total drug costs, including the beneficiary and insurance company's costs, reach $4,020 in total drug costs. The beneficiary is then asked to pay 25% for generics and 25% for brand names. The coverage gap starting and ending criteria may differ with some drugs. When a beneficiary has paid $6,350 in out-of-pocket costs, catastrophic coverage kicks in. Beneficiaries pay a small copayment for generic brand name drugs or a 5% coinsurance, whichever is greater. Let's talk about selecting Medicare coverage. The internet is full of information about Medicare, but not all of it is accurate. This is the official website for Medicare. It should have the most up-to-date information. The information contained on this site is deemed accurate and reliable. Like most websites, the layout and design of this site may change in the future as it is updated by CMS. The Medicare.gov Plan Finder tool is a great way to see what Medicare plans are available in your area and help you decide which is best for you. Please contact a SHINE representative to assist you in selecting the best Medicare coverage for you. let's talk about financial assistance programs available to Medicare beneficiaries. I mentioned this a little earlier in the presentation. There are two programs that the SHINE program can assist you in applying for. One is called the Medicare Savings Program. The Medicare Savings Program is a part of the National Medicare Program and is designed to help beneficiaries with income that does not exceed 135% of the federal poverty level. The federal poverty level can change every year. There are different tiers to this program. You may know them by their tier names. If you have QMB, SLMB, or QI1, you're participating in the Medicare Savings Program. Depending on a person's gross monthly income and assets, they may be eligible for a reduced Part D premium or deductibles, and will only have to pay a minimal amount for their prescriptions. These people are qualified for extra help. Certain people automatically qualify for extra help and do not need to apply. Individuals with Medicare and full Medicaid benefits, individuals with Social Security income but not Medicaid, people who are enrolled in the Medicare Savings Program, and people who meet their medically needy share of cost at least once a month during the calendar year. This is a type of Medicaid. Other people with Medicare should file an application with the Social Security Administration to find out if they qualify for extra help. They can apply with Social Security directly online at ssa.gov, or if you'd like, a SHINE counselor can assist you with this application. Let's talk about Medicare fraud and abuse. Medicare abuse is the payment for items and services that are billed by mistake by providers but should not be paid for by Medicare. Medicare fraud is purposefully billing for services that were never given or billing for a service that has a higher reimbursement than the service provided. The difference between Medicare abuse and Medicare fraud is intent. Now, let's learn the 3 most important steps that will prevent you from becoming a victim of Medicare fraud and abuse. Prevention. Here are some tips to protect yourself from Medicare fraud. Treat your Medicare card like you would a credit card. Only share Medicare cards and numbers with trusted sources who need that information to serve you, i.e., a doctor or pharmacist you're directly working with. Do not rely on advice or offers from unknown persons who call, visit, or approach you in public. Never sign a blank medical or insurance form. Detect. Medicare sends you 2 notices with your claim information. The 2 notices are the following: your Medicare Summary Notice, also known as an MSN, or an Explanation of Benefits, also known as an EOB. These notices allow you to review your Medicare claims and check for possible mistakes. Report. If you see something unusual on your MSN, check with your plan or call SHINE. If you get a call from someone requesting your Medicare number, do not give it out. Call the Federal Trade Commission and your local law enforcement. The Federal Trade Commission's phone number is 1-877-382-4357. If you believe you are a victim of fraud or abuse, contact your local law enforcement and SHINE for more information. SHINE counselors offer free and unbiased assistance to help seniors identify, understand, compare, and enroll in all parts of Medicare. We want to make sure that if you need assistance, you know that you can call a SHINE counselor and schedule an appointment today. If you have any questions or comments, please reach out to your local SHINE program. We're PSA 9, St. Lucie on the Treasure Coast. Our phone number is 866-684-5885. If you're in another viewing area, please reach out to the Florida Department of Elder Affairs SHINE State Program at 1-800-963-5337. Thank you so much and have a great day.